Hello and welcome to the Eye, your English news bulletin. I'm Esther. These are the headlines. The first cases of the COVID-19 Delta variant B1617.2 has been reported in Mon district of Nagaland after samples that were sent for testing at ICMR/RMRC Dibrugarh on June 2 returned positive. More than 350 doctors and medical workers have caught COVID-19 in Indonesia despite being vaccinated with Sinovac, and dozens have been hospitalized. Police in Chhattisgarh's Raipur have registered an FIR against Yoga Guru Ramdev for allegedly spreading false information about the medicines being used by the medical fraternity for the treatment of COVID-19. Now for the news in details. The state government informed that the high-powered committee on COVID-19 in its meeting held on 16 June 2021 reviewed the situation in the state, and it has observed that the positivity rate of COVID-19 in the state continues to remain high, above 5% in all the districts of the state, warranting the need for taking adequate measures for preventing the spread of COVID-19. Also, after taking the views of the Health and Family Welfare Department and the district's task force, the Chief Secretary J. Alam has directed that the existing lockdown measures shall continue to remain in force in the state from 19 June to 30th June, with the given provisions that there shall be a total ban on the movement of individuals and vehicles from 4 p.m. to 5 a.m. every day across the state, except for reasons and purposes for those who are permitted to move as per the existing lockdown measures. The district task force, based on local conditions, may take additional stricter measures in their respective districts areas if, in its opinion, such measures are urgent. Police in Chhattisgarh's Raipur have registered an FIR against Yoga Guru Ramdev for allegedly spreading false information about the medicines being used by the medicinal fraternity for the treatment of COVID-19, police officials said on Thursday.
The case was filed on Wednesday night against Ramkrishna Yadav alias Baba Ramdev based on a complaint filed by the Chhattisgarh unit of the Indian Medical Association, Raipur's Senior Superintendent of Police Ajay Yadav said. Ramdev has been booked under Section 188, Disobedience to Order duly promulgated by Public Servant, 269, Negligent Act likely to spread infection of disease dangerous to life, 504, Intentional Insult with intent to provoke breach of the peace, and others of the IPC and provisions of Disaster Management Act 2005, he said. Doctors are God's envoy on earth, Ramdev says will get COVID-19 vaccine jab. Further investigation into the matter is underway, he added. Chairman of Hospital Board, IMA, Dr. Rakesh Gupta, IMS Raipur Preston and Vikas Akarwal were among doctors who had earlier lodged the complaint. As per the complaint, since over the last 1 year, Ramdev has been allegedly propagating false information and his threatening statements on social media against medicines being used by Medical Fraternity, Government of India, Indian Council of Medical Research, and other frontline organizations in treatment of coronavirus infection. There are several videos of him on social media in which he had allegedly made such misleading remarks, it said. At a time when doctors, paramedical staff and all branches of government and administration have been together battling COVID-19, Ramdev has been allegedly misleading people about established and approved treatment methods, the complaint said. Ramdev's remarks on modern medical facilities and allopathy medicines, which have been curing over 90% of the patients, would put the lives of people in danger, it alleged.
The first cases of the COVID-19 Delta variant B1617.2 has been reported in Mon district of Nagaland after samples were sent for testing at ICMR/RMRC NE Dibrugarh on June 2nd, and results of all 5 samples that were sent returned positive for the variant. Speaking to Hornbilltv, the Deputy Commissioner of Mon, Tavasilan K, informed that the testing was based on target spike gene sequencing. Making known that this variant is more transmissible and dangerous, he urged everyone to get vaccinated. However, upon contacting an official from the Health and Family Welfare Department regarding the detections of the variant in Mon, the official pointed out that ICMR Dibrugarh is not a designated laboratory identified for whole genome sequencing or WGS. It was informed that for the Northeast region, the identified laboratory to carry out WGS is in Kolkata, and only 10 labs in the country is certified by the Ministry of Health and Family Welfare to carry out WGS. In this regard, the official informed that the samples have been sent for retesting at designated labs, which is in Kolkata, and results are awaited. It may be mentioned that the World Health Organization, which has given it the label Delta, has categorized it as a variant of concern, VOC. It has said it continues to observe significantly increased transmissibility and a growing number of countries reporting outbreaks associated with this variant. The WHO classifies a variant as a VOC when it is associated with an increase in transmissibility or detrimental change in COVID-19 epidemiology, increase in virulence, or decrease in the effectiveness of public health measures or available diagnostics, vaccines, therapeutics. The Deputy Commissioner of Parents, Cindy Wapang Iyer, on 17 June launched the relief distribution for daily wage earners at St. Xavier College Auditorium Hall, Jaluki, in the presence of ADC Jaluki, NZPO President Ward Union, and St. Xavier College Principal. The relief items were arranged and provided by District Management Authority, PEREN, in collaboration with the District Administration. Moving further, the Centre has extended until September 30 the validity of driving licenses, vehicle registration certificates, fitness certificates and all kinds of permits which expired after February 2020 and could not be renewed because of the restrictions imposed to check the COVID-19 pandemic. In an advisory, the Union Road Transport and Highways Ministry on Thursday directed transport departments against prosecuting motorists using the documents that have expired since February last year.
Driving without a valid license attracts a penalty of Rs 5,000, while the penalties for other invalid documents are Rs 5,000 registration certificate, 10,000 permit, 2,000, 5,000 fitness certificate. Officials clarified that expired pollution under control certificates have not been granted an extension in their validity. Taking into consideration the grim situation, it is advised that the validity of all the referred documents whose extension of validity could not or was not likely to be granted due to lockdown and which had expired since 1st of February 2020 or would expire by 30th September 2021, the same may be treated to be valid till 30th September 2021. Enforcement authorities are advised to treat such documents valid till 30th September 2021, said the advisory. All the states and union territories are requested to implement this advisory in letter and spirit so that the citizens, transporters and various other organizations which are operating under this difficult time may not get harassed and face difficulties. The Delhi Transport Department was expected to issue a specific order following the centre's directive, officials said. This is the sixth such extension after earlier advisories in this regard. A Transport Department official requested people against queuing up at regional transport offices in Delhi unless one has to get a learner or a permanent license for the first time. The ministry has extended the validity of fitness, permits, licenses, registration or other documents under Motor Vehicles Act 1988 and Central Motor Vehicle Rules 1989 till September 30, said the official who did not want to be named. The State Transport Department said it was burdened with a deluge of queries regarding driving licenses, fitness certificates and permit renewals. The processing of driving licenses involves a waiting period of up to 2 months. The RTO at New Delhi's Sarai Kale Khan is one of the busiest transport offices in the city. It would conduct up to 250 driving tests on its semi-automatic driving test tracks daily before the pandemic. Now, only around 80 tests are conducted daily. The number of online tests for learners' licenses has come down to 50 daily.
The central government will provide more than 56 lakh vaccine doses to states and union territories in the next 3 days, informed the Health Ministry on Thursday.
More than 56,70,350 vaccine doses are in the pipeline and will be received by the states and the UTs within the next 3 days, the Ministry of Health and Family Welfare said. According to MOHFW, as many as 2.18 crore COVID-19 vaccine doses are still available with the states and UTs to be administered. More than 27.28 crores vaccine doses have been provided to states and UTs so far through Government of India free of cost channel and through direct state procurement category, the ministry said in an official statement. Of this, the total consumption, including wastages, is 25.10 crore doses, as per data available at 8 a.m. today, it said. More than 2.18 crore COVID vaccine doses are still available with the states and UTs to be administered, it added. The Union Health Ministry further informed that 26.55 crore vaccine doses have been administered so far under the nationwide vaccination drive. India started the world's largest vaccination drive on January 16 this year in a phased manner, with healthcare workers getting inoculated first. The vaccination of frontline workers started on February 2. The next phase of COVID-19 vaccination commenced from March 1 for those over 60 years of age and for people aged 45 and above with specified comorbid conditions. India launched vaccination for all people aged more than 45 from April 1. Phase 3 of the vaccination drive was started on May 1 for the beneficiaries belonging to the age group 18 to 44.
In solidarity with the nationwide Doctors' National Protest Day with the objective to stopping assault on the profession and professionals, the medical fraternity in Manipur under the Indian Medical Association Manipur State Branch will join a demonstration tomorrow by wearing black badges and by showing banners and placards demanding a stop to the violence on the professionals. The demonstration is to express anguish and solidarity and to make sure that the government come out to the public and assure the Central Hospital and Healthcare Professional Protection Act with IPC and CRPC standardization and augmentation of security in each hospital, declare hospitals as protected zones and punish perpetrators with stringent punishment. However, the demonstration won't affect the functioning of hospitals and the doctors won't be refraining from performing their duties. The IMA also says about 700 doctors in the country, including 6 doctors from the state, have died during the second wave of COVID pandemic. It is unfortunate that violence at COVID workplaces is reported from time to time, such as the recent deplorable incidents of violence at the JNIMS ICU. The third COVID-19 wave could hit Maharashtra within the next 2 to 4 weeks. The state task force has warned in a grim reminder for the state which was battered by the second wave of the pandemic.
The task force, however, said children would not be affected as much as those in lower middle-class clusters that haven't been exposed to the virus so far. The predictions were made in a meeting chaired by Maharashtra Chief Minister Uddhav Thackeray, the Times of India reported, with data pointing to the fact that the total number of cases in the third wave could be double of those in the second wave, with active cases reaching 8 lakh. It is also expected that 10% of the cases could come from children or young adults, a phenomenon also seen in the first 2 waves. Stressing on the need to practice COVID-appropriate behavior, Dr. Shashank Joshi, member of the task force, said the state could face the same situation as UK, where a third wave hit within 4 weeks of ebbing of the second wave. On a conservative estimate, epidemiologists expect up to 100 days between the peaks of 2 waves or 8 weeks from the decline of 1 wave to the next peak. Maharashtra has seen a 5-level unlock model in the past 2 weeks, with over 15 districts and some cities like Nagpur and Pune enjoying some relaxations.
In other news, a Delhi High Court on Thursday issued warrants for the release of student activists Natasha Narwal, Devangana Kalita and Asif Iqbal Tanha from Tihar jail after they were granted bail from the High Court in the Delhi riots case on June 15, noting that delay in the verification process by the police cannot be a plausible reason for the accused to be kept imprisoned. pulling up the police for delay in verification of addresses and sureties. Additional Sessions Judge Ravender Bedi said that by itself it cannot be a plausible reason for the accused to be kept imprisoned till the time such reports are filed. The activists had moved the Delhi High Court for the immediate release from the jail after the trial court had reserved the order on the Delhi police plea, seeking more time to verify documents of their release. While hearing their petition, the Delhi High Court earlier today asked the trial court to decide with promptitude and expedition the issue of release from jail of the trio. A bench of judges, Siddharth Mridul and AJ Bambani, asked the counsel for the accused and the Delhi police to jointly mention the matter before the trial court at 12 p.m. The three student activists were arrested in the May 2020 and are accused of being the masterminds of the February 2020 violence, which had left 53 people dead and more than 200 injured. The High Court, while granting them bail on June 15, had observed that in an anxiety to suppress dissent, the state has blurred the line between right to protest and terrorist activity, and if such a mindset gains traction, it would be a sad day for democracy. Meanwhile, the Delhi police has moved the Supreme Court, challenging the High Court judgments granting them bail in the case. A 21-year-old woman was stabbed to death by a stalker in Kerala's Malappuram district on Thursday, and her younger sister, who was also stabbed, was hospitalized, police said.
In what appeared to be a planned assault, 23-year-old assailant K. Vinesh first distracted the victim's father by setting his shop on fire in Perintala before entering her house and attacking the woman. When she was left alone with her 13-year-old sister, police said, and added that he also stabbed the younger sister when she tried to rescue the victim. Malappuram Police Superintendent Sujit Das said, quoting local residents, that the accused was the victim's senior in school and used to stalk her. Last year, her father filed a police complaint and he was left off with a warning by the police. Vinesh was also questioned once for alleged use of drugs when in school, and the victim's relatives therefore opposed his acquaintance with her, the police officer said. He is believed to have attacked her since she was spurning his romantic advances. After the incident, the accused boarded an auto rickshaw, but the driver got suspicious after noticing his blood-stained dress and took him to the nearest police station instead. Thus said, Vinesh is in police custody and further investigation in the case is on. The younger sister of the victim is now reported to be out of danger, the police officer said.
More than 350 doctors and medical workers have caught COVID-19 in Indonesia despite being vaccinated with Sinovac, and dozens have been hospitalized, officials said, as concerns grow about the efficacy of some vaccines against more infectious variants.
Most of the workers were symptomatic and self-isolating at home, said Badai Ismoyo, head of the health office in the district of Kudus in central Java. But dozens were in hospital with high fevers and declining oxygen saturation levels. Kudus, which has about 5,000 healthcare workers, is battling an outbreak believed to be driven by the more transmissible Delta variant, which has pushed up its bed occupancy rates above 90%. Designated as a priority group, healthcare workers were among the first to be vaccinated when inoculations began in January. Almost all have received the COVID-19 vaccine developed by Chinese biopharmaceutical company Sinovac, the Indonesian Medical Association IDI says. While the number of Indonesian healthcare workers dying from COVID-19 has dropped sharply from 158 in January to 13 in May, according to data initiative group Leper COVID-19, public health experts say the Java hospitalizations are caused by concern. Spokesperson from Sinovac and Indonesia's Ministry of Health were not immediately available for comment on the efficacy of the Chinese firm's CoronaVac against newer variants of the virus. The World Health Organization, WHO, approved emergency use of Sinovac's vaccine this month, saying results showed it prevented symptomatic disease in 51% of recipients and prevented severe COVID-19 and hospital stays in all of those studied. As Indonesia grappled with one of Asia's worst outbreaks, registering more than 1.9 million infections and 53,000 deaths, its doctors and nurses suffered a heavy toll of 946 deaths.
AstraZeneca said on Tuesday a late-stage trial failed to provide evidence that its COVID-19 antibody therapy protected people who had contact with an infected person from the disease, a small setback in its efforts to find alternatives to vaccines.
The study assessed whether the therapy, a cocktail of two types of antibodies, could prevent adults who had been exposed to the virus in the past 8 days from developing COVID-19 symptoms. The therapy, AZD7442, was 33% effective in reducing the risk of people developing symptoms compared with a placebo, but that result was not statistically significant, meaning it might have been due to chance and not the therapy. The phase 3 study, which has not been peer-reviewed, included 1,121 participants in the United Kingdom and the United States. The vast majority, though not all, were free of the virus at the start of the trial. Results of a subset of participants who were not infected to begin with was more encouraging, but the primary analysis rested on results from all participants. While this trial did not meet the primary endpoint against symptomatic illness, we are encouraged by the protection seen in the PCR-negative participants following treatment with AZD7442, AstraZeneca Executive Vice President Min Pangalo said in a statement referring to the polymerase chain reaction test which diagnosed COVID-19. The company is banking on further studies to revive the product's fortunes. 5 more trials are ongoing, testing the antibody cocktail as treatment or in prevention. The next one will likely be from a larger trial testing the product in people with a weakened immune system due to cancer or an organ transplant who may not benefit from a vaccine.
That's all for tonight's English News Bulletin. Do subscribe to our channel and also follow Hornbill TV official on Twitter, Facebook, YouTube and Instagram. I'm Esther. Keep watching Hornbill TV.